So wellness, the Cleveland Clinic experience, why and what for you? We've given you the why. We've started to give you the what with tobacco cessation. Let's now show you what we've done for physical activity, food choices, and then the future. So the second thing we tackled on this group of 4 was physical inactivity. By the way, it isn't the second thing I would tackle now, but tobacco and one of the others are what I would tackle immediately, and I'd add physical activity, and then the next one, food choice and portion size, pretty fast. We gave our employees free Curves membership, free Weight Watchers, free fitness center, free yoga classes. Why did we make our fitness centers free? It was only $18. Do we pay them so little that they won't do it? No. What happened was, it was a part of the culture change that we learned about with smoking. People keep healthy choices in one pocket and medical expenses in the other, and the two never mix. So they aren't going to use their money they're saving from tobacco to pay for tobacco cessation. We learned that. Same thing with fitness centers. You got to break down the barriers and make it absolutely free. And what happened? The number of hours of fitness center usage has gone from a little over 2,500 a month to over 30,000 a month, a 12-fold increase. Even physicians who are paid, and all of our physicians are on salary, even physicians who are paid $150,000 and more a year, when you take away that $18 charge, their use of our fitness centers went up substantially. You say, why is it? Were they so cheap? No, it's the culture change. And that's the first step. You've got to get a culture change. We'll come back to what's needed in part 3 for your practice. But, in fact, the third thing we went to is food choices and portion size. We've done a little, we're moving much more. So we've done 52 things in food choice and portion size. Everything from changing what's in every vending machine, and you got to patrol it. The guy who fills our vending machine also fills it at the neighborhood university. Neighborhood university doesn't give a damn what their students and faculty get. You know, kill them with food. But we care, and so we have only food that is actually fits the GO criteria. We took out all the fryers. Did we tell people? No, we didn't tell them. Did sales go down? No, they didn't go down because we didn't tell them. We put the fried in parentheses. Now we call it baked fries. Can you get baked fries that taste every bit as good as the other fries that were served? Or even McDonald's fries? And the answer is yes. Had to go through 16 taste tests, but we did it. We took out sugared beverages. People complain? Yeah. In fact, you know, I got a number of death threats when we took out cigarette cessation, when we banned cigarettes and banned hiring smokers. But those were in, if you will, unmarked envelopes sent to me. What about when we took out sugared beverages? I got 75, but those were emailed to me, so we knew who had sent them. Not real serious. But you will get some complaints. Sales go down for a couple months, and then they come right back up, and they buy the if you will, sugared beverages. We then decide to label food, Cleveland Clinic Go Healthy, when it met these criteria, less than 4 grams of saturated fat per main course or per meal, less than 4 grams of added sugars and syrups. Why did we choose those 4 grams? Because that's the number above which your blood sugar rises to a level at which you start to change your protein function. Hemoglobin A1C starts to get glycosylated if the average typical person has more than 4 grams of added sugar per hour. We also had some sodium, no trans fat, and only whole grains. And we label food in stores. Why? Because you shouldn't need a magnifying glass to find out if something is healthy. In this store, there are 16 brands of peanut butter, and 2 of them are healthy. You shouldn't have to read the labels of every one to find out which 2. It should be on the package. So we did that in the neighborhood stores, both high-end and one of the inner-city chains of grocery stores. And now we are tackling stress. But before I do that, let me tell you the incentive program, because there are 4 components. I've gone over them briefly. A culture change where we message about how important this is because of job competitiveness, because of the patriotic for the country to be competitive, for the budget of the country, but also for them to feel healthy. The second thing was we had programs. So you saw the program, that e-coaching program to help people quit smoking or lose weight, or the Weight Watchers or Curves or the Fitness Center. Those are programs. The third thing is we changed the environment. So it was hard to get something that was unhealthy. You can't buy a sugared beverage on campus. You can't buy food. It's not easy to buy food that is unhealthy from a vending machine. And the fourth thing is large incentives. So we raised the premium on health costs about what the national average was and the local average in 2009 by 9%. But if you had normal blood pressure, normal LDL cholesterol, hemoglobin A1C, a body mass index under 30, and no cotinine in your urine that reflected more than secondhand smoke, you got all of that money back, 100% of it. So there was no increase. You still were at 2009 rates. The benchmark for people with chronic disease that participate in a chronic disease management program in medical care communities, about 12%. The highest, we were told by one of the consultants, 15%. In the first 6 months, we got 35%. We've now gradually increased that premium differential to be about 21%, and about 60% of those with chronic disease participate, and over 85% of all others. In fact, it's over 95% now of all others. And that was based on the fact, some Medicare data, that if you have 5 normals when you enter Medicare, those 5 normals, blood pressure, the same ones we went over, blood pressure, LDL cholesterol, hemoglobin A1C, or fasting blood sugar, waist for height, no cotinine in your urine, your lifetime costs are 33 to 50%, and even your last year of life costs are 50% less. So we offered this series of programs for weight management. Our employees have stepped up and have lost 394,000 pounds. And what happened to our costs? Well, like the country or the world or most individuals, our healthcare cost was increasing out of proportion to our revenue. It was about 9% per year increase. But over a period of time, these programs flattened the curve. And in fact, in 2002 to 2005, our costs were increasing at 9% a year, and our chronic disease incidence or prevalence was increasing about 10% a year. 4,000 diabetics in 2002 out of our 43,000 employees, 4,400 in 2003, 4,900 in 2004. What's happened since? Well, last year, our costs actually decreased, even in face of increase in provider charges and a 9% increase in pharmaceuticals, and in fact, a richer benefit pool. And chronic disease turned down as well, decreasing 2%. Now, I said, what is needed to do this? And I know I'm going ahead pretty fast, but let me show you what we found. We need all 4 to sustain the change. Aha moments, the culture change. Dr. Cosgrove gets out there with 1, 2, or 3 people every month at our connection and shows how great they have changed their health. Some of what this month, someone lost 200 pounds was demonstrated. But in fact, it's people who've normalized their blood pressure or gotten more vigor. And that's a key. It's a constant thing. You can't do a culture change once and expect it to last. It's a continual education of your staff or your patients. It's continual saying that wellness is what we need to lower the costs. We need to decrease the incidence and prevalence of chronic disease. We need to become job competitive in America, and this is what brings jobs back to America. Our medical costs are one of the biggest discompetitivenesses we have. You change the environment. We've told you about changing the environment, having vending machines that are healthy, walking paths, the full thing, the full gamut. Social programs, buddies through e-coaching, programs that I'm going to show you like Stress Free Now and social media that get people involved in practicing with each other so that they can get healthy. And then an effective and large incentive strategy. You've got to get over the reptilian brain. Why does large help you do that? Well, if you're going to get $1,000 or not get $1,000 because of walking, as you stop to walk or think about sitting down instead of walking, you say, hey, that's $1,000, and it gets to a higher order of brain. At least that's the theory of why this works, so that you get all four: an effective large incentive strategy, social media and socialization, environment changes, and aha moments. So our Healthy Choice program had something special in it that got it to that level. We did this by accident. We did not have a good enough, we had a great electronic medical record system, but we didn't have a good enough HR system for our own employees. So we give them a health visit form every 2 years. There are 2 tracks, one for the 6 targeted diagnoses, one for the healthy status, and an annual personalized letter that tells the people who don't have the 6 normals what to do. What happened? Well, what happens is they took this form to their personal physician, and instead of saying, I don't want to go on that medicine, or instead of not filling that blood pressure pill, they then went to the doc and say, get me normal on these 6 things. How do I get normal on these 6 things? It changed the conversation between the patient and the primary care physician, or in our case, the employee and the primary care physician. The healthy join fitness center or do an online tracking program or something else to maintain their goal status. The unhealthy join this coordinated program, if you will, which takes away co-payments, which takes away DME coinsurance, which takes away co-payments for pharmacy. And there's a tier, so we started with 3 tiers, pretty imaginative, eh? Bronze, silver, and gold. We're now adding, as we add the dependents, platinum and diamond. Diamonds are more a higher scale than platinum. I have to keep remembering that. But it's for improved participation. We got improved utilization, improved cost trends, improved quality measures, and improved weight control. And this data that Dr. Tripwick and Dr. Rogan and our group said, look at it. If you look at the percent of unique employees with diabetes, hypertension, asthma, hyperlipidemia, or BMI greater than 27 enrolled, you'd say, well, why do you have so few? Why is it only, whatever it is, 40 or 50%? It's now at 60%. This is a little old data. And the reason is because some people don't recognize themselves as being sick. If you will, people who are obese, they don't think they have obesity. There's a great deal of denial. Hard to deny asthma. And what's happened? The cost utilization trends, if you will, the encounters on the outpatient, the pharmacy costs have gone up, but the inpatient and the admission and the ER visits all go down. And, if you will, every quality measure we measure has gone up substantially for our own employees. They're getting healthier. The people who enrolled in the BMI program, their weights have gone down. The people who had the problem but didn't enroll, their weights have increased a little bit. Remember, your job is to get these 4 factors out of the patient's system: tobacco, physical inactivity, bad food choices, or bad portion size. The next step for us is unmanaged stress. Now you'd say, why didn't you tackle stress earlier? Come back for the next segment and I'll tell you the answer to that.